I have a 10-physician practice, 1 PA, and 4 audiologists. So basically I've got 15 providers. I get the pleasure of managing their billing office and their IT. Well, when I first got to the practice, patient collections was our weakest area. And I can recall that one of the staff, when I was talking about doing these letters, was like, I don't know why we would do that. And I said, well, our patients have been conditioned not to pay because we have consistently sent out final notices numerous times. So they no longer know that the final notice is the final notice. So when I told them we were going to stop doing that, we were going to start having you guys send out the letter, they were like, they ignore our letters. What do you think that's going to do? And I said, well, let's try it. Let's see. I mean, worst case scenario, if they ignore theirs, there's nothing gained, nothing lost. The cost to send out the letters is less than what it costs us, so it's fine. 3 months, 4 months after that, that employee came up to me. I had only been with the practice probably about a year. Employee came up to me and said, that was the best thing you've done since you got here. My philosophy was, we were spending time calling patients during business hours at home. That was a waste of our time. One of the things that I valued and respected the most about this system is that you now have the ability to have the patients call you. And they call you from wherever they choose to call you. It doesn't matter. Anybody that's serious about paying their bill is going to call you. I don't have time to waste my staff's time and energy calling people to leave a voicemail for them to dodge the voicemail and then maybe get a call back. When the patients do call back, my staff's gone. None of my staff wanted to stagger and be in late at night to answer these phone calls. So it's like a voicemail tag system. Not effective at all. I want my staff to work on doing what they're supposed to do, collect the money. There's so many different variables in healthcare. I like the security of knowing that I'm going to pay a set amount for a proven system that works, that gets me paid, rather than me sit there and find out who's going to take money from me. I'm actually now getting the money that I should have been getting along, but I don't have to work as hard. From my point of view, there's not a practice that I will ever work in that if I have the decision that I will not be using a system like Transworld. It is my preferred way of dealing with patient collections.